screen. So, all right, so I'm going to share the screen with you really quick. Okay, are you able to see that, ma'am?
Yes.
Okay, awesome. All right, so let's see. With the first here. So first, we're going to start by doing our introductions really quick. I'm going to do this by stating our names and our roles. So I'll begin. My name is Cornelia Sabaya, and I'm a student at GCU, and I will be the interviewer for this meeting. Can you introduce yourself really quick as well?
Yep. My name is Johnette Ducart, and I am a speech language pathologist in District 11.
Awesome. Great. So the purpose of this meeting is to discuss roles of various members of the special education team, and it should take about 30 minutes. Is that okay with you, ma'am?
Yep.
Awesome. So I'll just go through over the agenda for this Zoom meeting. So today we just did the introductions and stated our purpose. So we're gonna go through characteristics of individuals whom we serve, services available for those individuals with disabilities in your district. We're gonna discuss about specific steps in the IEP process, how special education and general education teachers are supported in the IEP process, collaborations with members of the IEP team, supporting families of individuals with disabilities, addressing behavioral issues for students with disabilities, professional developments, and special education law, also known as IDEA. Okay, so on our first slide here, let's see. Oh, do you mind if I grab like a paper and a pen really quick?
Oh, that's fine.
Just 1 sec. Yep. All right, got it. Let's see. So just the first question here. So can you discuss the characteristics of individuals with exceptionalities whom you serve, including gifted as well as those with disabilities?
As a speech pathologist, I currently am working in a high school only. Most of the students that I work with have, at this level, have more significant difficulties. These students may have intellectual disabilities. Some of them are on the autism spectrum. Some of them have Down syndrome. And several of the students that I work with currently are nonverbal. So they use picture communication. Some of our students are deaf and hard of hearing as well. So I see quite a variety of students.
Okay. Let me see. Okay, thank you for that. So our second question here, can you describe the educational, developmental, and medical services available for individuals with disabilities in your district?
We have pretty much everything. All of our schools have special education teachers who are highly qualified in their areas. We have school nurses, speech pathologists, school psychologists, social workers, occupational therapy, physical therapy. So there's quite a wide variety for students within our district. We're also fortunate to have schools at elementary, middle, and high school that are the center-based programs for students who have who are deaf and hard of hearing, so that we have a teacher of the deaf in the building along with educational interpreters that are able to support them in their classes.
Okay.
So that really helps to kind of streamline those services for them as well.
All right. Okay, thank you. The next question here. Could you describe the specific steps in the IEP process?
Do you just kind of need a general overview, or how in depth are you looking for?
So just the general overview should be fine.
Okay. Specifically at the high school, most students that have an IEP have already been identified. There's not a lot of initial evaluations at this process. So most often we have an IEP that we are starting with, and then we move on from there. So each student is assigned a case manager who's responsible for development of the IEP. They meet with the student and their families to kind of build rapport and get to know each other. That case manager will be responsible for tracking their progress towards their IEP goals. They're also selecting courses for them to take in high school. They do observations. They track grade and credit information. They collaborate with other professionals. So if a student has services from the school social worker or myself as the speech pathologist or OT and PT, then they collaborate all together to make sure that the student needs are being met. As we get closer to an IEP meeting, we discuss what the plans are for the student moving forward after high school. And then we design the IEP with the end in mind. So if a student wants to become a mechanic, what classes can we help them to register for that will help them to become a mechanic after high school? We develop goals that are measurable and attainable within a calendar year for the IEP. And then we have to determine how much time they're going to be in with their general education peers so that they can still receive the specialized instruction that they need, but also have access to the general education classroom and curriculum.
Okay. All right. Thank you. Let's see. Could you explain how special education and general education teachers are supported in the IEP process?
Special education teachers, they're primarily responsible for making sure, obviously, that the IEP is kept in compliance and that it's being followed and that it meets the student needs. They work very closely with the general education teachers because our goal is to have them in the general education class receiving that first instruction as much as possible. So a lot of times we may provide support for accommodations and modifications that the teachers can use in the classroom, and they usually benefit all students, not just the students that are on an IEP. We provide professional development for general education teachers oftentimes. And, if we need it, we have resources within the district who can come in and help to provide additional professional development or observations and support as needed.
Okay. All right. So the next question here. So describe how you collaborate with members of the IEP team and list other stakeholders you collaborate with as part of the IEP process and describe this process collaboration.
Okay. The IEP team includes the student, the families, all of the service providers for that student, whether it be just the special education teacher, or if there's speech pathology, OT, PT, teacher of the deaf, whoever the direct service providers are. We also collaborate with the general education teachers. Sometimes there will be a behavior interventionist who's helping to monitor and track data for students that have behaviors that are keeping them from accessing their education. We talk to outside service providers, because a lot of times families have ABA therapists or private speech therapists or counselors or other therapists for different things outside of school. So we will get release of information forms signed by the parents so that we can collaborate with their outside providers as well. Some of our families are in the foster care system. So then we also add other stakeholders such as a guardian ad litem, DHS caseworkers, group homes, or facilities that they may be in. So we pull in every person that's possibly involved in this student's life to really make sure that we're meeting their needs.
And I have a question on that. Do you know, let me see, do you know if it's required for the student to attend the IEP meeting?
Yes. It is required pretty much for the high school level, but it really is important for students who are younger to start getting involved in the process. As a speech pathologist in the schools, I've worked with preschool all the way up through high school now. And seeing how disengaged students are at the high school level as far as their IEP process, they're used to the adults in their life dictating what their IEP is going to be, what they're going to work on, what their goals are, and everything else. And we only have them for a very short time. We have them for 4 years before they're completed with their credits and out. So we're really trying hard to get more of our middle and elementary schools involved in really getting the students involved in the IEP process so that they have something to share and they have that feeling of ownership. And the IEP isn't something that's thrust upon them, but they have a better understanding of why they have an IEP. Because we also see, sorry, I'm kind of getting off track, but we also see, especially at the high school level, that so many students are kind of at the point where they're feeling like they're going to just give up on education completely, because they know that their learning style is different from their peers. However, they see it as that they're not smart, they're stupid, they can't do things, rather than, like nobody's ever truly explained to them, your brain works differently. The chemicals in your brain make it difficult for you to focus and pay attention. These are the strategies that we're giving you to work around that so that you can be successful. So they really don't have an understanding of why they have a difficult time learning. They just know that it's they have a much harder time than their peers, and it starts taking a real social emotional toll, especially on the middle school to high school level students.
Oh, thank you. Let's see. Can you describe what you do to support families of individuals with disabilities?
It varies widely, especially for some of our students who have more significant support needs. Meeting with the families, definitely on a more consistent basis. We provide contact information for local agencies in the community that can support them, getting them, like with support groups for families with students with disabilities, providing training and support, especially if they have communication devices, and teaching them how to use those devices with their student, teaching that, finding resources to teach the families sign language when their student is deaf or hard of hearing, connecting them with agencies. Like here in Colorado, we have the Resource Exchange, and they provide a lot of supports for our students with more significant needs when they have cognitive deficits and are not able to be as independent as some of the students who are higher functioning. So they provide case managers who support the family with community resources such as respite care, so that they have people who are highly qualified and trained and come in and work with students who have maybe difficult medical complications or behaviors, so that the parents and caregivers can kind of get a break every once in a while, because they are often the ones who are left out when the service is focused on the child, that the families need some support as well. So we kind of reach out to those agencies to try to support the families.
Okay. Okay, next question here. Could you explain the process of addressing behavioral issues for students with disabilities?
And that's a big one, especially this year. We have noticed that even without students with disabilities, that behaviors are significantly increased after the pandemic. But truly, like, the biggest piece is finding out why they're behaving the way that they're behaving. And, kind of digging down and finding out what's the function of their behavior. Are they trying to avoid something? Are they trying to gain attention from somebody? Are they trying to escape a situation that makes them feel uncomfortable? So that's the first aspect of it, is really trying to figure out why they're doing what they're doing. And then especially for students who have communication needs, oftentimes, or most of the time, their behavior is a method of communication. So if a student doesn't have the words to be able to tell you, I don't feel well, or, my head hurts, or, even I need to use the bathroom, oftentimes these students will exhibit behaviors like screaming, or they may throw something, and it's their way of getting attention. So it's really finding out why the behavior is happening, and then we can work toward finding replacement behaviors or other methods of communication to try to reduce those behaviors.
Okay. All right. Let's see. Yeah. Okay, discuss the professional development that is available to you regarding special education policies, services, and educational strategies.
Our district has a variety of
Mhm,
professional development trainings that are optional that people can choose to go to.
mhm,
As it kind of varies on what's coming through. We have trainings periodically to review special education policies and,
mhm,
if there are any complaints that have been made to the state that have gone into due process as far as the legal
mhm,
aspect of things. And, a lot of repetition as far as these are the things that must be in the IEP. This is what happens, like this is how you can deal with
mhm,
a contentious situation possibly that, emotions may be running high and it seems like, the team can't come to a consensus as far as how to word something in an IEP or services. So it's pretty much ongoing. And they also will sometimes support, depending on funding availability,
mhm,
for providers to receive compensation for attending local conferences or other trainings for people that
mhm,
come to the area to provide specific training so that we can have that growth
mhm,
in that way. And then we have building level professional development that's more geared toward
mhm,
the whole building. So, like, for example, my building right now is doing building-wide professional development
mhm,
or universal design for learning, and that's kind of bridging the gap between general education and special education as far as,
mhm,
if a student has a reading disability, how can we support them and all learners in a class so that they can access um, articles and textbooks and things like that. So it's kind of opening doors for other students rather than just the students with identified disabilities.
Okay, let me see. So I noticed that you already answered some partial,
Yeah.
some in this second one. Let's see. Do you know who leads the training? So specific training that you relate to confidentiality, and do you know how often it's required?
I don't I don't know that it's specifically stated anywhere of how
Mhm,
often it's required, but it is addressed at least once a year.
mhm,
We have special education trainings. Each building has what our district calls a staffing coordinator. And
mhm,
every month, the staffing coordinators get together, and we are kind of the primary people that are given the information, and then it's up to us to distribute it to the people in our building,
mhm.
so that they don't have to have several hundred people come together for one training.
Yeah.
Um, and so that's typically how it's done.
Mhm,
So they'll touch on it. Yeah, I would say once a year, but
okay.
it's
Mhm,
within the buildings. Like when we're sharing IEP snapshots or information about a student,
mhm.
that we remind the people in our building that only the teacher who has this student in class needs to know this information. It's not for anybody else. So it's kind of an
Mhm.
ongoing
Okay.
uh, thing that's reinforced, but not necessarily training.
Okay. All right. So this is our last question right here.
Mhm.
So let's see. Special education law, also known as Individuals with Disabilities Education Act, IDEA, is a federal law that ensures a free, appropriate public education to individual children with disabilities throughout the nation and ensures special education and related services to those children. Can you discuss what you do to stay current on special education laws?
Personally, I am involved with several organizations. So I'm on like email listserv through the state of Colorado. So I get emails from CDE as far as things that are coming up as far as special education law. We've also had a couple of occurrences over the years where a parent has made a complaint to the state regarding services or how an IEP meeting was run, or they have a concern of some kind. And at the state level, they say, okay, D11, you need to go back and retrain your special education staff, or remind, make them aware of this concern so a complaint like this doesn't happen in the future. And then that will come through either an email or a webinar or something from the district to pass that along. I'm also part of several like Facebook groups that are specifically related to special education and speech language pathologists, so that we can kind of have open discussion that's ongoing as far as things that are happening. And then it also allows us to collaborate with people and consult with different people in different states of how they're handling some of the changes to law, because when things are changed at the federal level, then it goes to the state level to interpret it, and then it goes to the districts to interpret it. And different people in states have their own kind of twists on how they choose to interpret some of the laws. So it's interesting to be able to talk with other people about the implications of some of those changes. So that's that's pretty much how I stay current on special education law. And of course, we have the 37-page packet of procedural safeguards and parent rights that we share with our families. So being able to kind of pick out the most often used and important pieces of information for families as well.
All right. Let's see, go back here. All right, pause share. All right. Hey, thank you so much for this interview. I know it was just kind of hard to find somebody to interview, especially today.
Not a problem. As I said, I apologize for not answering your email sooner.
That's it.
It just, my email box gets loaded and then everything just shifts to the bottom and it's out of sight, out of mind.
All right. Yeah, one more time. I have all the information that I need. So
okay.
Thank you very much for your time.
Thank you. I hope it goes well.
All right. You as well. Thank you so much and have a nice day.
Thanks. You too. Bye-bye.
Bye.
You working?
Oh, hello.
Hi, can you hear me?
Yes, I can hear you. Yes, ma'am.
All right.
I'm very sorry about that, ma'am.
Yeah, no worries. I'm not the best when it comes to Zoom because we use WebEx, like a WebEx thing. So I'm not familiar a lot with Zoom, so I was making sure everything was in.
It's kind of very tricky. So let me just, I know there's a way to share the screen. That way I can, let me see, it says right here. That way you can see the questions. So, there you
Where
go.
are you out of? Are you out of the Colorado Springs or are you?
Yes, I'm in Fort Carson right now. So I was told last minute to see a provider. So it's running back and forth.
Oh, yeah, no worries.
Yeah, it's good that I'm here now. So let's just get started really quickly, and then
Yeah, I
I
bet.
know you have work to do as well. Yeah.
All right.
Yes. So today I'll be doing the interview here really quick about my field experience on special education. So let's see here. We're going to start by introducing ourselves really quick and stating our roles. So my name is Cornelia Sabaya, and I'm a student at GCU, and I'll be the interviewer for this meeting.
Okay.
Yeah. Can you introduce yourself really quick?
Oh, my name is Lisa Van Dyke, and I'm a school nurse at Palmer High School.
Awesome. Thank you.
Uh-huh.
So the purpose of this meeting is to discuss roles of various members of the special education team. And this should take about 30 minutes, but we're kind of late, so I'll say about 10 minutes.
Okay, that's right. If you need to go a little bit longer, I'm okay. It's whatever. I have a little bit of flexibility.
Okay, thank you so much, ma'am.
Uh-huh.
Let's go. This is the agenda right here. So this is just what we're going to be covering through this interview. So we'll go to introduction, the characteristic of individual who you serve, services available for individuals with disabilities in your district. We're going to discuss about special steps in the IEP process and how special education and general education teachers are supported in the IEP process. We'll talk about collaborations with members of the IEP team, supporting families of individuals with disabilities, addressing behavioral issues for students with disabilities, professional development, and special education law or IDEA. So the first, go to the first question here. So let me see. So can you discuss the characteristics of individuals with exceptionalities, whom you serve, including gifted as well as those with disabilities?
So as a school nurse, my role is mainly with kiddos with disabilities in our SPED program. We have kids who have autism. We have kiddos who might need a feeding tube or some sort of disability of that nature. We also take care of Down syndrome kiddos and things like that. Then we just have, so there's special, like our significant needs room. And then there's just our general IEP who may just have a mild intellectual disability or may need speech therapy or something like that. So under the state law, I have to do a health assessment on every initial IEP and every tri, which is a triennial. So I make sure that nothing medically has changed. And if they're fall under OHI, that's how they're being classified. Or, that's how they're determined of eligibility is for OHI. Then I do a little bit more in depth because that's other health impairment. So it could be for ADHD or, they're legally blind or something like that. But most of ours, either our SED kids, the emotionally disturbed kids, or the intellectual disabilities or learning disabilities. Okay. And I don't deal a lot with the gifted part of it, like the IB program or anything like that. If they're gifted, they're at or above grade level, and they're gen ed kids usually. And if they have a medical need, like say they're diabetic, that is a 504 because they don't have an IEP because they're not below grade level.
Oh, okay.
So an IEP is different than a 504. Okay. So a 504 is for students who, so say I have a type 1 diabetic who might need some accommodations in class or during testing, like their blood sugar needs to be within range while they take a test. Or their ability to test and treat in their classroom so they can test and give themselves insulin in the classroom, but they're at or above grade level, that's a 504. If their disability impacts whether it be a medical or a regular disability, like intellectual disability, if that affects their education and they're below grade level, then they get an IEP.
Okay. So, all right, thank you so much for that. All right, this is the second question here. All right. Can you describe the educational, developmental, and medical services available for individuals with disabilities in your district?
I'm sorry, you're cutting in and out.
Okay. The internet. Hold on. The internet here is kind of terrible. So try to load it up. Okay, hold on. Okay, are you able to see that? The screen? Okay, 1 second.
I can't hear you very well because you're cutting in and out, but I can read the, you want me to tell you the educational development and medical services available?
Yes. Yes,
Okay.
please.
Oh, now you're back.
Okay.
So in our district, we have the services available. You know, we have in-school occupational therapy and physical therapy, speech therapy, and then we can also provide them out-of-school resources to use, like the Shandy Clinic or something like that. And we also allow for students to have personal nurses with them. So home health agencies like kids on ventilators or G-tubes, I have the ability to delegate certain tasks to non-licensed professionals. But if they choose to, or their doctor would like them to have a private duty nurse, we do allow those also in our school. So we allow that. Medical services available for individuals. So that's, if we have kiddos who need a special doctor or a special service, we can reach out. We have a list of community resources that we get for them. Also, we can have a list of doctors that can help them with learning disabilities and stuff like that. But in our school, we have social worker and speech pathologists who do a lot of the work, and school psychiatrists and psychologists. So a lot of the stuff we'll do, like the Woodcock testing and stuff like that in our schools.
Oh, okay. All right. Thank you. Next question. All right. Could you describe the specific steps in the IEP process? So just the general steps of the IEP process. Yeah.
I'm sorry, you cut in and out. Is it the next slide that you're saying?
Yes, correct.
Okay, it's frozen. Can you go to the next slide, or are we stuck?
Okay. So hold on.
Oh, there we go.
Yeah.
Okay, gotcha. Okay, so for the IEP, we cannot proceed with any type of testing or assessments without parental consent. So first we have to send home a parental request asking if it is okay that we assess your child, even for annuals and triennials and initials. So we are not allowed to perform anything until we get that back. Once we get that back, we have 60 days from the day that we've received the request to test. In the consent and request to test, we have to include everything that we are going to be doing. So like the school psychiatrist has to say exactly what test they want to do. Our pathologists have to state every test they want to do.
The internet here is terrible. The internet we have. The internet we have.
I figured.
There you go. All right.
So once we get that, then we can run our specific things, and we do what's called an eligibility page. So we are having evidence to make sure that this child is meeting through the evaluation process, that he meets the criteria to have an IEP. So with all the different disciplines, OT, PT, speech, his teachers, his grades, all his different testing, once that is all completed, then it goes and you have specific goals for the IEP. Then you have the IEP meeting, and then you address any specific goals and stuff to help that child reach those goals. You'll need the accommodations. So say they need extended time on testing, they need a smaller classroom environment, they need a one-to-one adult supervision because they're a fight or flight risk or something like that, then we include all of those on there.
Okay. All right, thank you. All right, scroll down. Okay, can you explain how special education and general education teachers are supported in the IEP process?
So we have a special education coordinator, and they're the ones who are in charge of getting all of the information together to disseminate to the SPED team. So once, and then they're like our contact person. They set up the IEPs, they know when the triennials are and all that other stuff. And once the IEP is completed, then they send it out to all the teachers so the teachers can follow it, because it's mandated by the state that this IEP is a legal document and needs to be followed. So we also have an icon in our Power Schools, which is our system, that we put our grades in. We have student contact and things like that. And there's a little icon that says that they have an IEP. So, and it's only specific to that teacher, because we fall under the FERPA law, FERPPA, and that means that only it's a need to know basis, even for like educational material that's all confidential. So if I'm assigned, I have everybody because I'm assigned to every student in our district because I float around from school to school. But if you only have that teacher, so say Mr. Smith has Jane Doe, then he can only, Jane Doe's teacher can only see her icon, and he
Oof, this is very frustrating.
That's okay, I'm sure.
Very, very frustrating. All right, go back here. All right. So just go to the next question here. That way we could just cover like partial questions. That's fine.
Okay. Describe how you collaborate with members of the IEP team. List other stakeholders you collaborate with as part of the IEP process. Okay, so like I had said, we do the SPED coordinator. We talk to audiology quite a bit for our deaf students. We do physical therapy, occupational therapy, school psychologists, all of their teachers. And then we also incorporate any outside resources that they have seen. We just like say they've seen a neurologist and they have a full neuro report, then we include that in there also. So we do both internal and external resources that we use.
Okay, perfect. So next question here. So could you describe what you do to support families of individuals with disabilities?
So for me, like, for example, for part of my SSN room, I have a kiddo who's nonverbal, wheelchair bound, with the G-tube. So I train all of the EAs on how to change him, how to deal with his seizures. He has a VNS, which is a vagal nerve stimulator. So he has a magnet. So I train them on how to swipe his magnet at seizure. I train them how to do all of his tube feedings, things like that. So to make sure that they're up to date with that, because I can teach them how to do nursing tasks through the Nurse Practice Act of Colorado. So I make sure that they're squared away and know how to take care of these kiddos medically. And then when we have some troubleshooting on some behavior kiddos, we need to make sure, like, for example, if a kiddo is fighting, but they have some mental health disorders or opposition defiant disorder or RAD or autism or something like that. I assist them with the suspension process, because if they continue to be suspended, they cannot face like a suspension or an expulsion from our district if it's based on a disability. So we have to do that and have hearings and stuff like that through like our court system.
Awesome, thank you. And let's see, we have 3 more questions left. Okay.
Yeah, that's okay.
Could you explain the process of addressing behavioral issues for students with disabilities?
So, which I kind of did a little bit earlier, some of our kids with behavior issues, we create a BIP plan, BIP, and that's a individualized behavior plan that we use for them. And that is giving them, like, say I have a student who can't control his anger. We'll say different steps and goals on what we need to do using your words, not acting out, not hitting, going to a safe place, finding a safe adult, and then alternatives to like anger or lashing out would be like, I'm going to draw, I'm going to listen to music. So we do all of these plans, but we do have kids who maybe have gotten to a fight or have maybe like smoked weed or something like that. And we have to do a manifestation to see if that behavior is a manifestation of his disability. So sometimes maybe an intellectual disability, he doesn't know right from wrong. Or something like that. He's nonverbal. So he hit someone, but he's nonverbal and doesn't understand right from wrong. That's going to be based on his disability, then, we do a different process for that. If I have a kid who is verbal and has all these opportunities on his BIP plan and he chooses not to, and he still gets into a fight and annihilates some kid, then we have to go through the manifestation, and that's with our administration and downtown administrators and our behavioral health team that we have.
Okay, thank you.
Uh-huh.
Okay, here looks like we have two portions of these questions. So can you discuss the professional development that is available to you regarding special education policies, services, and educational strategies?
So there are some things. Nursing is a little bit different because we're trying to fit my medical world into an educational field. So there's not a lot of professional development for PTs, OTs, audiologists, any of the medical side of it. But the educational piece of it, First Sped has a ton of opportunities through our district. They provide that. And through our licensure with CDE, we have to do so many continued education credits. So I have to find all of my own continued education credits because they don't provide any for nurses. So I have to hold an SSP license with CDE, that's special service provider. That's going to fall under our OTs, PTs, audiologists, things like that. So I have to have my registered nurse license through DORA, and then I also have to have my SSP license through the CDE. But there's not a lot of out there. I have to find my own normally. But I'm part of a National Association of School Nurses and Colorado School Nurses. So I find them through those things, not necessarily through our district. And then for confidentiality, we do have to take a little bit of training for that, but it's led by the district, and it's just, but that's everyone because it's all of FERPA. So FERPA is gen ed teachers, regular, SPED teachers, janitors, anyone who may have contact with this child in a school setting. It's a district thing that we have to do. Now, I do my own because as a registered nurse, we have HIPAA, and HIPAA falls under FERPA. So it's all included into that.
Okay. So let me plug this on really quick so it doesn't die.
Sure.
Okay, there we go. Perfect. All right, the next question here. Can you discuss whether there is specific training related to confidentiality, including who leads the training and how often is it required?
So I kind of touched base with that. The HIPAA and FERPA combined, the district will provide training for that, and we do that annually.
Okay. All right, perfect. Let's go here. Last question here. Okay. So special education. Are you able to hear me, ma'am? Hi.
Yes.
Yes. So special education law, also known as IDEA, is a federal law that ensures a free, appropriate public education to eligible children with disabilities throughout the nation. It ensures special education and related services to those children. Could you discuss what you do to stay current on special education law?
So I usually do that part of my continuing education credits that I need to get my SSP license. So I have to, but unfortunately I have to find those myself because the district doesn't provide those. But sometimes they'll provide a few of them. So I just keep looking up, making sure that nothing has changed. I'm also part of the Colorado School Nurse Association. So anything that comes down the pipes, they always let us know firsthand. And then I can look into the laws and regulations independently. But they're my first defense in letting me know if something has changed or making me aware of something.
All right. Perfect. So that was the last question. And I just want to thank you so much for your patience and your time, because I know we were supposed to go until 11.
Yeah, no, that's okay. That's okay. If you have any questions or maybe an answer wasn't clear or you need, just email me and then I can email you back. Like if it's for an assignment or something like that, or you didn't understand a question or one was skipped, just email me and I'll email it to you.
Awesome. Thank you very much.